Thank you very much, Patrick. Good morning, everybody. It's a pleasure to convene us. Some of us were here yesterday, and we're delighted to be back with you. I want to start by perhaps inviting Dr. Zhao to make some welcoming remarks before we move into the business of the workshop. Victor, would you like to join us at the podium? Victor's getting an onslaught of a lot of input as he began his term, and we have been delighted to hear that, and we know of his history in global health and also his commitment to global health as far as the IOM is concerned. So,
thank you, Joe. Well, thank you. That's a surprise, but that's good. I can just welcome all of you and to say that I see lots of familiar faces. This is an area that I'm actually very passionate about. Some of you know me, and I see Scott over there and others, that I think public-private partnership is really a pathway towards solutions of many of the challenges we face globally, if not so nationally as well. What better ways to bring together people with all different interests, but probably with one common interest, which is how to make this world a better place. And we see every day the challenges, shall we say, that the public sector faces. In my own work, and particularly in the health arena, I founded an organization called the International Partnership for Innovative Healthcare Delivery, or IPHD, with McKinsey and World Economic Forum. And it's very clear that when you look at the public sector, the public health systems, they're overwhelmed with the kind of work they have to accomplish, the care they need to deliver, and their limited resources, if you will, with always government budget. The private sector has the possibility, in my opinion, to bring in value by creating innovation and disrupting the way we do things and working along with the government to actually create a better health system. This morning, I was just talking to my friend Krishna Yudhakuma, who's now the executive director of IPHD, and I said, my dream actually is that if IPHD is successful, the private sector innovators will be asked by the government to say, come join us as part of the solution, because your idea we can adopt in treating diabetes, where we are struggling, you can work together and create a new way of doing things. So as we look at Ebola, and it's very clear to me, that's another great example where the mobilization of people from all different sectors is really critically important, that no single country or entity can do it alone. Now, as you think about the public-private sector relationship or partnership, obviously, there's a whole range of possibilities beyond the examples I just gave. But I do believe that bringing together not only resources, but ideas, and the way which you can find common ground is, I think, truly the solutions for the future. And this is what we do at IOM. We convene people. We are a neutral, trusted place, as you heard from Patrick. This is a place where people from industry, academia, government, public can all come together. And we may have differences, but I bet you can find a lot of common ground. And when you find that, it's amazing the kind of things you can do. So I look forward to hearing some of your outputs. And I told Patrick I wanted to be here simply because I think this is such an important forum. Thank you very much. Thank you, John.
thank you, Victor. And let me begin by introducing my co-chair of the overall Forum on Public-Private Partnerships, Clarion Johnson, formerly of Exxon. Clarion, just to acknowledge. And he chaired the previous workshop of this forum, and so this is my pleasure to co-chair with Jack Waters, who's my other colleague here, this workshop over the next day and a half. So let me provide a little bit of background on the PPP Forum. It was launched in the fall of 2013, and really, as others have said, it's really reflective of the growing role of the private sector in contributing to diverse global health initiatives, and we have a terrifically diverse group of companies involved here, ranging from MAC Cosmetics to United Parcel Service to John Deere Tractor and sort of everything in between, which really is a reflection, I think, of the broadening a definition of health and the determinants of health, and an understanding that everyone has an opportunity to work to create health or to perhaps create problems for health in countries. So we're very excited about that diversity. And the other thing I'd say about the group since it's convened is it's a very sophisticated group, and we also have members of government, members of the civil society sector working in global health. And they said, we have looked at we've read the literature, we've seen the definitions of PPPs. We don't want to spend our time doing public-private partnership 101. We really want to jump over into the 300 level sort of advanced exploration of what's working, what's not working, and how do we all move together to have a greater impact on health in the countries in which we're working in and in the partners with which we're working. So it's been very exciting and challenging, and this workshop is really a reflection of that motivation that emerged from our earlier meetings, which is we sort of brainstormed some of the positives and negative experiences people have had around partnerships, what their aspirations are, how they want to have things done better. We've really designed this workshop to explore these in much more depth and take advantage of the sort of norms we've been creating in the group of people speaking very frankly and sharing their successes and their failures so that we can really learn from each other. The group has met in our sort of business organizational meetings, which have plotted our course. We met in January of this past year. We had another organizational meeting in June, and this is the second workshop of the forum. The first was held in July and focused on universal coverage in occupational health and safety for informal workers in low and middle income countries, and that workshop was supported by the Rockefeller Foundation. And a summary of that workshop, along with this one, will be turned around probably in April or May. Kimberly says April, I'll say April or May, give them a little bit of wiggle room, but we will have the results of these workshops because we really are interested in documenting these conversations and creating products. We have other collaboratives, we have other papers and working groups that we're involved with, and so a lot of activities are sort of circulating based on the interests of our members. I want to thank particularly the planning committee colleagues who helped put this together. Jack Waters, of course, my co-chair, Patricia Daly, maybe they could raise their hands if they're here in the room, Elaine Gibbons, Louise Gresham, Jim Jones, I think he did make it, oh good. B.T. Slingsby and Wendy Taylor, all of whom were very involved in the design and also in helping us identify the fantastic roster of speakers that we have. As Patrick mentioned, we are webcasting this activity, so I want to acknowledge those who are participating virtually, and we also have planned this event so that we have a lot of time for questions and answers. We'll, as is our habit, try to focus initially on the Q&A and interaction from the members of the forum, and then others who are visiting in this room, or if you're watching it in your offices and you want to run downstairs, there are microphones along the side that you can use to ask questions and get them answered. So I think without further ado, let's get started. And it's my pleasure to introduce, we have two, let me just review, I'm sorry, the objectives for today. I think I've said them, but it's really to engage in multisectoral dialogue, to use this opportunity to learn from experiences, and also to see if we can come up with new models that are evolving or that we might decide we want to work on the design of to make PPPs even more effective. The workshop is really organized in a few sessions. This morning's activity is two keynote presentations to kick us off, followed by a session after the break on assessing the needs and motivations for engaging in partnerships. After lunch, we'll begin sort of two parts of looking at the challenges and people's experiences. And then beginning tomorrow morning, continue that work with case studies. And then, of course, we could not convene a group as important as this and not explore the Ebola crisis as an example, really not of how there has been an emergency mobilization. What can we learn from that to see how we could create a more sustainable opportunities in that way? And then we have a terrific group of individuals who are with us for the entire time who will help summarize from their perspectives what we've we've talked about. So let me begin by introducing Laura Herman. She is Managing Director of FSG, a mission-driven consulting firm that helps foundations, nonprofits, governments, and companies create large-scale, lasting social change, and she leads their global health practice and will talk to us about creating shared value and collective impact from her experience. Laura?